Peace be upon you, and God's mercy and blessings. Doctor, we watched your video about the lymph nodes in the neck, and some of the things you told us to be worried about are actually present, and we really got scared. So, to be reassured, what should we do? Let me remind you again, we said that if these lymph nodes are found in a man over 40 years old who smokes or drinks alcohol, and they are not painful, there is no sign of infection, and they are a bit hard and larger in size, then that's something to pay attention to. They don't move and they don't hurt. So if we find these things, we need to examine and follow the steps in order so we understand. Look, the first thing is to visit an ENT doctor to check our throat and teeth. We should go to a dentist if there's a problem with a tooth or an abscess under a tooth. We examine the nose, ears, and the entire neck. And we do, yes, an endoscopy right there in the clinic while we're sitting. No need for anesthesia or anything. We look at the throat, the nose, and the larynx, and we check that the ears are fine and examine them. If we find a reason for the lymph node, we note it. What is the next step after the examination and the endoscopic check? We perform an ultrasound on the neck to determine the size and shape of the gland, whether it appears benign or not so good. After doing the ultrasound, sometimes that's enough, and sometimes we do a fine needle aspiration cytology, meaning we use a needle under ultrasound guidance to take a sample from the gland and analyze it. Then we see whether it's something good, meaning benign, or if there's a problem. A malignant tumor or a tumor that has spread to the glands, the lymph nodes. This needle gives us good information, and sometimes, along with the needle or even before it, we might do a CT scan of the neck with contrast. It shows us all the areas in the neck and tells us whether this gland is bad or good. What we do is that in most cases, if we find something with the endoscope, we proceed with the endoscopy. The first scan that shows something, we can address it and deal with it, and wishing you a speedy recovery. And may God grant everyone a speedy recovery. If you like these videos, please click like and subscribe to the channel if you're waiting for more from us. New videos. Wishing you all the best and a million times good health.